Hello, my name is Selma Schimmel, and I'll be guiding you through information about risk assessment and testing for hereditary breast and ovarian cancer. Now, most cases of hereditary breast and ovarian cancer are caused by inherited changes or mutations in two genes, BRCA1 and BRCA2. This video is about the tests you can take to find these mutations. You'll learn about the features and cancer risks of hereditary breast and ovarian cancer and hear medical options for people with HBOC syndrome. And we'll cover the benefits and limitations of testing for BRCA1 and BRCA2 mutations to help you determine if testing is right for you. If you or your healthcare provider conclude you might have an inherited risk for breast and ovarian cancer, testing is the most accurate means available to see if you have a BRCA1 or BRCA2 mutation. And knowing if you have a mutation will give you power. For example, my mother died of ovarian cancer in her 50s, and I had breast cancer in my 20s. Now, by the time I was in my 40s, my doctor and I realized I should have the test, and so I did. And ever since I found out I'm a carrier of a mutation, I've taken measures to prevent and combat cancer so that I'm able to be here today to talk with you. If you are at greater risk, you can also increase your surveillance, starting monthly self and clinical breast exams, yearly mammograms, and MRIs at an earlier age, and starting annual or semi-annual transvaginal ultrasound examinations and CA-125 testing as early as age 25. Women with a BRCA1 or BRCA2 mutation can also take prescription medication to reduce their risk of cancer. Drugs such as tamoxifen have been shown to reduce the risk of breast cancer in high-risk women, and oral contraceptives may reduce the risk of ovarian cancer. Now, another option that some women choose is preventive surgery. Preventive mastectomies reduce the risk of breast cancer by at least 90% in women with BRCA1 or BRCA2 mutations. Most women follow preventive mastectomy with breast reconstruction. Preventive removal of the ovaries, which is done after childbearing is complete, significantly reduces both ovarian and breast cancer risk. Things that can increase your chance of having hereditary breast and ovarian cancer syndrome include the following red flags: a family or personal history of breast cancer before age 50, or ovarian cancer at any age, or bilateral breast cancer, or both breast and ovarian cancer, or male breast cancer diagnosed at any age. In addition, your risk could be raised if your family includes a relative with a previously identified BRCA mutation, or if your family is of Ashkenazi Eastern European Jewish descent. Those of us with an alteration or mutation in either the BRCA1 or BRCA2 gene face a much higher risk of developing breast and ovarian cancer. In addition, we are much more likely to develop it earlier in life, before we turn 50. Also, our risk of developing a second cancer is increased. There are three types of tests for BRCA1 and BRCA2 mutations. A comprehensive BRCA analysis examines the entire BRCA1 and BRCA2 genes, looking for mutations that could increase your risk of inherited cancer. This is the test most people would have if no one else in their family has been tested yet. A single-site BRCA analysis test looks for a specific mutation that has been previously identified in your family. So if you have a relative with a BRCA1 or BRCA2 mutation, you would have single-site testing to see if you inherited the same mutation. And a multi-site 3 BRCA analysis test is for individuals of Ashkenazi Eastern European Jewish ancestry and is designed to find the 3 most common BRCA1 and BRCA2 mutations found in this population. If you are able to take the single-site test for a mutation already identified in your family and no mutation is detected, you did not inherit the increased risks of cancers associated with HBOC syndrome. You do, however, still have the general population risks for breast and ovarian cancer. Many people have comprehensive testing because there is no previously identified mutation in the family. If no mutation is detected on your comprehensive test, the chance that you have HBOC is significantly reduced. However, a small chance remains that you have an increased risk for cancer due to other factors, for example, another hereditary cancer syndrome, or a mutation in BRCA1 or BRCA2 that current technology cannot detect. If you have a negative comprehensive BRCA analysis result, your cancer risks should be estimated and managed by your healthcare provider based on your test result as well as your personal and family history. In some cases, the test will uncover a genetic alteration or variant, and the significance of this variant is not yet known. In that case, your cancer risk will not be clarified by your test result, and your healthcare provider should base your medical management on your personal and family history of cancer. BRCA1 and BRCA2 mutations can be passed down from either your mother or father from generation to generation. Other benefits of BRCA analysis testing include the ability to get a personalized risk assessment. You can then use that information to pursue the most appropriate medical management to help reduce your cancer risk. In addition, for many people, knowing whether you have a mutation can reduce anxiety and stress. All medical tests have limitations. BRCA analysis testing detects most, but not all causes of hereditary cancer. Also, a negative test result is most helpful when there is a known mutation in the family. Finally, you may find you have a genetic variant of unknown clinical significance and need to be managed based on your personal and family history. Now, you may be wondering if your insurance will pay for BRCA1 and BRCA2 testing. The fact is that the majority of health insurance plans do cover most or all of the cost of testing. You may also have heard about the possibility of genetic discrimination, but the facts are that federal and state laws prohibit this type of discrimination. For me, knowing that I have the gene mutation empowered me to make vital health decisions for myself. In addition, identifying the gene allowed my sister to take the test. Now, she tested positive and is taking action. But all 4 of her daughters have tested negative and do not have HBOC, which I think is the best knowledge of all. Now you need to decide, is testing right for you? It is your decision to make based on what makes the most sense for your health care and for your family. Thank you for listening. Good luck with whatever decisions you make, and may you have the best of health.